Hello, this is Dr. Arti Kandolkar. I am a consultant psychologist and a counselor. Today, we are going to discuss on anxiety disorders, like what is anxiety disorder, what are the different forms of anxiety. You can also say there are different types of anxiety disorders. So we are going to cover types as well. Okay, some symptoms which are psychological, emotional, or you can say even physical. So this is what our entire topic is for today. Okay, so let's begin with understanding what is anxiety disorder, types and symptoms. So let's begin. So we'll study initially what is anxiety and an introduction to it and types. Next, we have seen the types, right? We'll be discussing about this, but now we'll see the definition of anxiety. Now there are a variety of definitions available on different sites and different books. Okay, so we have just picked up one among them, and this generally goes with the APA, that is American Psychological Association. So it says anxiety is an emotion. Okay, so it's an emotion characterized by feeling of tension. So feeling is also there. Worried thoughts, so thought is also covered, and physical changes like increased blood pressure. So what is anxiety? So anxiety covers almost every part, and you can say every structure of human being, that is emotions, feelings, thoughts, and you can say physical changes also. So it is affecting our entire physique, okay, internally and externally as well. So next, after seeing the types and the definition, let's move on to the introduction of anxiety disorder. Now, what is there in an introduction? So introduction will cover some points which will focus on anxiety and related concepts like fear. Okay, so let's begin. It says anxiety is a commonest psychiatric symptom. Okay, so that means it's a very common phenomena to occur in any human being. Okay, it's not something rare. Like you can say schizophrenia, or you can say mood disorder. It's something rarely to occur in a human beings, but anxiety is the commonest in you can say in general population as well as in a psychiatric ward or a clinic. You'll find this patient in a number of cases. Very routinely you will get these cases. So it covers around 20%. Okay, around 20% people on an average will suffer from anxiety symptoms. Second, you can see they have said something about fear. Now it looks like fear and anxiety are similar, but there is a mild difference. We'll be discussing about this. Okay, so let's understand one more point about anxiety is fear is a response to external danger, means outside danger, while in anxiety, the danger is largely unknown. So what is the difference between anxiety and fear? Anxiety is something internal, which you feel, okay, which you experience internally, okay, that is uneasiness and all, while fear is something external. You know something is outside and it is fearful. Like suppose there is a snake over here, or there is a spider or something which I'm scared. So that is fear, not an anxiety. But suppose it is an, what you can say, you know something is going to happen. There is an exam after some days. So you will be like, it is in response to future events. Okay, response to some stressor outside us. Okay, so it is like that's, means anxiety is internal while fear is outside our body. We know there is exam approaching. So it is something stressor. We perceive exam as a stressor generally. So it's a reaction to that stressor. That is, you can say, fear. Okay, so next, the third point, if we cover here, is anxiety is a state of apprehension. Okay, anxiety is a state of apprehension or unease arising out of anticipation of danger. We just already discussed about this. Is an anticipation, means you are predicting, assuming this something is going to happen, and mostly it will be negative. If something is positive, we call it eustress. Okay, this is something like a distress, negative event. So it is like we assume and it becomes uneasy. Okay, anticipation of some danger. Danger could be anything, like you are participating in some maybe bungee jumping or anything, it could be danger. Okay, outside. It's generally outside. Okay. And then the fourth point is anxiety becomes pathological. This is a very important term. Okay. Which significantly subjective distress and impairment in the overall functioning of an individual. So what does this mean? That it is pathological means it is something dangerous. It is something very, you can say, psychotic in nature. So it becomes dangerous. Anxiety is there in almost every individual. Just like there are 7 emotions, like there is something like excitement, there is happiness, sadness. Okay. Similarly, anxiety is 1 out of 7. It's not something different. Everybody has it, but it is called pathological or it is called disorder only when there is significant means larger quantity or which is very much visible, which is very much obvious. Okay, when it becomes significantly significant and it causes subjective means personal distress means something negative. Okay, so personally you are stressed, personally you are distressed. And impairments, it is disabling means it is making you disabled or it is making you not work or function properly. So your functionality is affected. So it is called impairment in the overall functioning of an individual. Overall means what? Overall means your all the major areas. Like for example, maybe you're doing some job, you are a parent, you have to look after your kids. Maybe you are in some social gathering, you have been given some social responsibility. Okay, everywhere. Okay, or even if you are personal, like grooming, taking care, brushing, having bath, this is your personal care. So even this is affected by anxiety. So this is like what I was trying to cover, like what is anxiety? This is an introduction to anxiety. Okay, so hopefully this is understood. The fifth one is panic disorder. Okay, so as the term panic means, generally you hear this term colloquially or in layperson's language, I'm panicky and I'm in a panic situation. Okay, so it's a very layman kind of a thing. So panic disorder has number of symptoms. Okay, we'll be seeing and how an anxiety is different from panic, although it is a form of anxiety. So panic disorder, let's begin, is diagnosed in people who experience spontaneous, okay, seemingly out of the blue panic attacks and are preoccupied with the fear of recurring attack. So for this you have to understand what is happening to a person who experiences panic. Actually panic means extreme anxieties wherein the person may feel dizzy. A person may feel what you can say, I'm going to die, or may get a chest pain just like a heart attack. The person may feel I'm getting a heart attack and the chest is paining, left hand is paining, the person is sweating, there is a breathlessness, you feel I cannot breathe properly, I cannot even have a sip of water. So, and even sometimes people do get temporary fever, means for a half an hour the fever will come and then disappear. Okay, so then it's sort of a panic. Okay, so even sometimes people with higher anxiety say that I have experienced panic attack. It's not so. It could be just higher anxieties. Panic attack will have severe, like I'm going crazy and I'm going to die. This is the feeling you get, and feeling of embarrassment and not able to get help at the right moment. And also in panic disorder, what happens is that you consistently in a situation like, I don't know when I'm going to get a next panic attack. Okay, your constant thoughts. Okay, so that is panic disorder. The next, there are 2 types of panic attacks. One with agoraphobia and without agoraphobia. Okay, so what is agoraphobia? We are going to discuss in the next slide. That is our 6th one. Okay. It consists of pattern of recurring panic attack. As I said, having one panic attack is called only panic attack. But if you're having more than 2 panic attacks, it is called panic disorder. That is the difference between panic and panic disorder. Okay. The next, main fear of losing control. So what happens in this, as I already said, you feel like you're losing control over the situation. Okay. You're dying, going crazy, embarrassed, not being able to get help, all this breathlessness, sweating, it's like fever can come. You can also feel nausea, vomiting, okay, unable to sleep. You can even shiver and vibrate when you are sleeping. So anything can happen in your panic, okay. Next, fear of having panic attack becomes a problem in itself. Like having going to get a panic attack becomes problem in itself. Like just I said, there is a anxiety spiral. Similarly, a person who had one panic attack or multiple panic attack feels that any time now I'm going to get another panic attack, okay, possibly leading to an agoraphobia. What is agoraphobia? Fear of spaces with crowd, etc. Means it's like fear of getting into the crowd, maybe sports arenas, or you can say theater, okay, or anything where a large number of people, and you feel escape from that place. Getting out of the place, if I get a panic attack, will be extremely difficult. So you avoid them at any cost. You will not go to any markets places or any fest is going on. So you will avoid them, okay. Any places where escape finding help is difficult or embarrassing, okay. So I hope panic disorder and just a panic, you have understood this. The next is, let's understand what is the difference between panic attack and anxiety attack. Are these two both appearing in our DSM-5 or ICD-10? So officially there you only find panic attack, and there is nothing called anxiety attack that is there in our DSM-5. Okay, it's officially not there. Colloquially or in generally we can speak about anxiety attack. So how it is different? So panic attack, as I said, they are more severe. Like you get all severe symptoms like breathlessness. Okay, you may get fever. It's very temporary fever. Okay, coming, it's 102 and it's not there within half an hour. Then you feel like you're going to die at any moment. Severe chest pain as if you're going to get a heart attack. It's just like an heart attack symptom. Okay, your left hand may pain. Okay, so all these symptoms are severe, while in anxiety, symptom may remain the same. What is different is severity. Okay, severity is less in anxiety attack, means you can just say it is a higher anxieties. Okay, so let's understand in some points. So panic attack may be expected or unexpected. So panic attack can occur unexpectedly when you are undergoing tremendous stress for over the period of time. You may not understand what may happen due to that overthinking and things, but you can get unexpected panic attack. Then there is something called expected also, means you already have had one or two panic attacks and now you are expecting to get a third one or fourth one at any time. So that is why it can be unexpected or expected. DSM-5 do not identify anxiety attack. Okay, it's not there in DSM-5. The next, there are similarity between the two due to severity. An anxiety attack often comes in reaction to stressor. Okay, you are walking down a dark alley and hear footsteps. This is just an example. And you are at the top of the roller coaster and looking down the large hill. So you get a sort of a, what you can say, anxiety attack. Okay, panic attack on the other hand come in reaction to a stressor, may be unexpected. So generally panic attack appears unexpectedly, or you already have had multiple. Then it's like you're already scared of having another attack and you get it. Okay, and unprovoked and unpredictable at times. During panic attack, the individual is seized with terror and fear of apprehension. Okay, they may feel that they are going to die, so that is so severe, or lose control, have a heart attack, as we already discussed. They have a host of physical symptoms which we discussed. There are many physical symptoms. Okay, which may include chest pain, tachycardia, shortness of breath, dizziness, nausea. And addition to this terrifying panic attack, people start worrying of the next panic attack. That is the how you get used to your panic attacks. Okay, if you have that anxiety that you will get another panic attack, that means you have a panic disorder. Okay. Now we also saw that panic attack is with agoraphobia or without agoraphobia, and we also tried to understand what is agoraphobia. So agoraphobia, okay, in agoraphobia people stop going to situations or places which they feel immediate escape might be difficult. Means going out of the situation is difficult, like you can say going for a party where huge number of people are there, or going for any football match, cricket match where number of people are there. There may be fest or some festival is going on, so you avoid them at any cost. Okay, they fear not being able to get back to their safe place. Now what is their safe place? Is their own home. So they feel if I go there and something drastic happens, okay, because they generally think negative. So something happens, like there is a fight occurs, or there is somebody puts firing on the like people area or something because somebody loses match. Okay, so they expect unexpected. Okay, which, and then they feel going home and being safe will be difficult. So that is why they get extreme fears. And there is one term which looks like similar to claustrophobia. Sorry, looks similar to agoraphobia is claustrophobia. Now what is this? This is just a difference. It's a type of agoraphobia. Claustrophobia is a fear of closed places. Okay. It's not like large number of people in an open area, difficult to escape. This is a fear of closed places, small places in a room. Maybe you are in a studio, or you may be in a very small area wherein you are experimenting or something. Okay, in a cave, anything that could be. So that is called claustrophobia, different from agoraphobia. Okay, but claustrophobia is a type of agoraphobia. The seventh one, which is there in our anxiety disorders, is GAD, that is generalized anxiety disorder. Okay, generalized anxiety disorder. Generalized means general, means it is appearing everywhere. Okay, it's not very specific. So a person who experience GAD experience anxieties in every walk of their life or majority areas of their life. Okay, so let's understand what is generalized anxiety disorder. So GAD is characterized by persistent. So generalized anxiety disorder, okay, is characterized by persistent, excessive, unrealistic worry about everyday things. Okay, even when there is no apparent reason or concern. Now what could be this? Like you are consistently worried. So this can start from your very mundane things like cooking in a day. Like suppose there is a maid who comes to cook, and you being having GAD, you have fear of everything. You start fearing whether tomorrow the maid will come. The anxiety start from day before. Whether tomorrow the maid will come or not, you start your anxieties. And suppose she comes, and then like how many I have to, like what order I have to give it to her? Will she do it? Will she do it properly? You get another anxieties. And suppose she doesn't come, then you have an anxiety that how I'm going to cover up this. Will I be able to stand for half an hour and make maybe 20 chapatis and vegetables and dal and whatever? So you get anxiety in everything. Then whether my people at home will like what I cook. What if they keep names for my food? Okay. What if they don't like? What if maid leaves permanently? Okay. What if I'm not being able to in a good position, or my sleep is not complete? So in short, like trying to explain you in a simple thing, the person is anxious of every single event possible. Okay, that is called GAD. Possible causes for GAD could be financially. You have experienced tremendous financial difficulties, maybe in your childhood. You have multiple health related issues, like you constantly get GI issues, mean gastrointestinal issues. Family, somebody is sick or somebody is not behaving properly. Work related, you are not happy with the work. Okay, there is overload. You have gone through a disaster issues, like there may be flood, something that your family financially, health wise, otherwise is affected. So all these things you have gone through and you have already got a hang of anxiety, you are used to it. Okay, so that is why diagnosed when person is worried excessively and at least for 6 months. So to identify GAD, what you have to know is the person should have these symptoms. Okay, you can refer them to the DSM-5 criteria. It is already well written. So the person should have meet the basic criteria, and 6 months is necessary. Okay. Now we'll move on to the next one. The treatment of GAD. How can you treat a person who get constant anxieties? Okay, there are some common things we practice in a clinic or in a counseling is medication. Mild medicines can be used. A person who has been suffering, not getting proper sleep, okay, constantly overthinking, you need to give mild medicines. You can refer the client to a psychiatrist. Psychoanalysis. Okay, GAD is caused by a conflict between the ego and id impulses. It's a deeper thing to understand. We'll be covering later on. Okay, so it is like conflict between your ego, that is realistic self, and your impulse, what you can say, on the spot reacting kind of a behavior. Okay, the ego fears punishment, but it cannot be extinguished. Constant anxiety and conflict has been displayed with the phobia. So it is like there is a conflict between your ego and the id. Okay, whom to satisfy? The id, which is like want things spur of the moment, right now I want to do this, or your ego, who is like more realistic. He'll tell you, it's like an executive, whether you should do or not. So a conflict may lead GAD. Okay. The third treatment could be cognitive therapy. Now, in cognitive therapy, what we do is our thought, which have become irrational or which are not helping us, we try to modify them and replace with the healthy ones. Okay, apparently most useful, but still shows limited success sometimes. Okay, and others is REBT, rational emotive therapy, existential therapies like gestalt therapy, person-centered therapy you can use. Okay, so these are the general treatment method for GAD. The next one, which is the 8th one in our, okay, 8 is obsessive compulsive disorder. As I said, this is gone to obsessive compulsive disorder and related disorder. It's a separate section of DSM-5. Okay, you have to be aware. Don't search it in an anxiety disorder itself. So this is what is obsessive compulsive disorder. Many people talk about this, that I'm OCD or I'm OCPD, obsessive compulsive personality disorder. Okay, so what is it? So this is like extreme fear of being right, of doing things perfectly. Okay, if I'm not doing things right in a particular direction, in a particular angle, or being very clean, things affects me. I'm not, what you can say, relaxed for that. Okay, so it is like OCD patients suffer from unwanted and intrusive thought that can't seem to get out of their head. So they are constantly having thoughts, okay, that something is not going right, often compelling to repeatedly perform ritualistic behavior and routines. So this is like, this word has obsession and compulsion. Obsession means your thoughts, you're thinking consistently something, okay, and compulsion means these thoughts leads you to perform some activity physically. So this is like your thoughts leads to compulsion, that is the behavior and thought leads to behavior. And if you do not get listen to your thought, then you get anxieties. Okay, so this is how it is. This may include excessive worries about dirt. You cannot tolerate dirt on a maybe your plate. Okay, you will wash them maybe 3 times, 4 times, and it's like unreasonable. The dust is going to come. You cannot keep on cleaning your hands or your utensils. So dirt of germs, excessive hand washing, checking things. Suppose you have locked your car and you have come, you'll again go maybe even 1 kilometer back and check whether you have locked the car or not. Or if you are moving out of your house, you have locked your home. After moving some steps, or after moving maybe 100 or 2 miles, or maybe 1 or 2 miles, chances are that you're going to come back to check whether you have locked or not. Okay, it's like people keep checking, okay, over and over again, having to do things just right. They have the fear, the thought that something is not right, something is not clean, my hands are not clean, okay, what I'm doing or what I'm talking is not right. So they keep repeating to themselves sometimes. Okay, then repeating action over and over again to get just things right or perfectly. So we had a case of a businessman who is to have a habit. So this person had come for counseling saying I have marital issues. Okay, so we thought, because there are constant fight between the wife and the husband, and then it was like when they came, it was not actually the wife told something issues, like he has a habit of getting involved in activities over and over again. Like since he's a businessman, he had a lot of cash. Okay, he get a lot of bundles of cash. So instead of checking it once at home, after checking at his office or somewhere, he'll check them at least 3 to 4 times, and it consumes at least 3 to 4 hours for him to continuously check. Then when he does some worship of the God early in the morning, the puja, it's like he has to do it in a counting. He has to do it like 1, 2, 3, maybe 100 times, 200 times, till it is complete, because he's not getting. So that is why the fights were occurring. Also, he has a habit of, if you are driving on a bike, okay, he has a habit of looking at some tree or person or any vehicle 3 times. He has to keep looking 1, 2, 3, and if it doesn't look, there is an anxiety. He has to stop. So in this bargain of looking 3 times at particular tree or things, there has been a lot of fights, and he has met with a multiple accident with his wife. So that is why the issue looked like a marital issue, but it was not a marital issue. It was just because his perfections. Okay, so this, the last one, the ninth one is post-traumatic stress disorder. Now, as you already know, there are some terms here. Post means what? After. Okay, after traumatic stress disorder. Trauma means extreme stress. Okay, it may be due to some death in the family, some severe accidents, severe chronic illness that you come, or maybe a war scenario. Okay, or something like that. So post an event stress disorder. So this is after an event which is very traumatic, you get some symptoms, stress related symptoms, that is called PTSD. Now what it could be? It could be anything, a severe accident, as I said, or it can be rape, it can be floods, famines, which has affected you in every aspect, emotionally, physically, socially. Okay, so this kind. So post-traumatic stress disorder, to begin with, is a serious, potentially debilitating condition that can occur in people who experience or witness natural disasters, as I said, who has lost many of things, even family members, severe accident when they are almost going to die or lost their motor parts. Okay, terrorist incident had happened in that particular area, sudden death which were not expecting in a family, okay, or loved one, war, violent personal assaults, okay, like killing, murders, rapes, okay, life-threatening events, All these events leads to post-traumatic stress disorder. And what are the symptoms? You cannot sleep. You get terrors, you get nightmares in this. Constant thoughts are there. A person can even become numb. Okay. PTSD often occurs with depression, substance abuse, and other anxiety disorders. So it is likely that our PTSD, okay, occurs with depression, means who has PTSD or experienced some traumatic event is likely to suffer from depression as well, other anxiety related disorders, and substance abuse. They may start drinking, having drugs, or smoking. If a phobia develops following a traumatic event, post-traumatic stress disorder is considered to be a diagnosis. Means, of course, after the event has happened, which is very much traumatic, PTSD is more likely to be diagnosed. However, traumatic events can precede the onset of PTSD and specific phobia. In a case, a diagnosis of specific phobia would be assigned only if all the criteria of PTSD are not met. It could also be a specific phobia if all the criteria in DSM-5 are not met for PTSD. So you can just say it is specific phobia. Okay. So there was one case of a girl who has been raped, and which is one of my earlier cases. She was suffering from PTSD. Like for the first session, she did not speak at all. Like she was suddenly getting heightened and crying. Okay, because all she was recalling was she was gang raped, and she was recalling all those incidences, and like she's a startled, means she's in her own world. So she couldn't speak for the first session. Even the second session for half time, almost for half an hour and more, she couldn't speak. But it is so traumatic. We had to put her on a medicines first to sleep, and then the therapy began. Okay. So last, we have covered all the 9 disorders. The next is, what is anxiety? Okay, when it happens, to whom it is possible, where, and is it treatable? These are my general questions that can come up in our mind. So if it is treatable, so the answer is yes, it is treatable. Okay, but it will take some time. It is developed over the period of time. Even order to go or minimize, it will take some time. So highly treatable, by that time difficult, and resistance to extinction. Exactly 100% it will go, it's very tough. Okay, the therapist has to be very expert in this. Then when it begins, so often it begins in early life, maybe childhood. Early onset childhood is also very much possible. Reported more by women than men. So women has specific kind of a structure which, like, brain and gut is connected, and they are more, according to the scientific research, they are more prone to anxiety. Okay, women are more prone to anxieties than the men, and reported more in Western culture because more it is identified and people are more aware now. Okay. The next is it comorbid? Now what is comorbid? Comorbid means, is it occurring with other disorders, along with other disorders? Just like you have BP, physically I'm talking, you have BP, then you may be comorbid with heart related issues, or you may be comorbid with sugar issues like diabetic and all. So these are comorbid, you are having multiple things together. Similarly with anxiety, it could be comorbid. Like with anxiety, you can have depression, you can have other stress related issues, you can have maybe mood related disorders, and any other kinds. Okay. Yes. So it is comorbid. The answer is yes. Often comorbid with other anxiety diagnosis, like for example, mood disorder and psychosis as well. Okay.